In this video, we will be demonstrating the use of the medication called Follistim. First, gather all of your supplies, and you will want to use proper hand hygiene. Wash your hands with warm, soapy water or utilize hand sanitizer. You should have alcohol swabs, medication cartridge, along with the kit containing the Follistim Pen. Next, we will open the kit containing the Follistim Pen. Remove the protective pen cap from the body of the Follistim Pen. Unscrew the yellow cartridge holder from the blue pen body, which will expose a black rod. Next, we will open the Follistim cartridge in preparation for loading the pen. Inside the box contains the cartridge containing the Follistim medication. You're going to grab the cartridge and take a look at the rubber stopper at the very top. We're going to be scrubbing the hub or cleaning this top with alcohol. Once clean, we will now load it into the Follistim pen face down so that the rubber stopper is at the end of the pen. Screw pin back together and ensuring that the navy triangle should line up with the yellow line. Now that you've loaded the medication cartridge in your Follistim pen, the next step is to add the needle to the end of the pen. Within your kit are multiple single-use needles. You will use a fresh needle for each medication administration. Once you've selected the needle, go ahead and open the safety cap, which will expose a needle. Use caution as you will be placing this in the end of the Follistim pen. You will place and screw the needle on tightly and securely. Next, we will demonstrate how to dial your prescribed dose. For this example, we will be utilizing a dosage of 225 international units. As a reminder, this is an example only, as you will be utilizing your own personal prescribed dose as discussed with your provider and or nurse coordinator. You will dial up the dose to 225 by twisting the yellow knob. The dose should line up with the line where it displays 225 IU for this example. Now that you have dialed up your prescribed dose, you will verify in the window of the pen that your dose is correct. Once verified that the dose is correct, go ahead and place the pen down and we will prepare the site for injection. Follistim is a subcutaneous injection, so you will be injecting this medication preferably in the lower abdomen. With the lower abdomen, it's important to note you want to stay within an inch or more away from the belly button and rotating sites for each injection. You want to make sure that you clean the area with an alcohol swab. If you can, you want to pinch an inch or a fold of the skin. Let the alcohol dry as this prevents stinging, and you will grab the pen in preparation for the injection by removing the outer sheath of the needle. There is an inner protective sheath that will also need to be removed. And now we're going to go in at a 90-degree angle in one swift motion, prepare for injection. Once injected, depress the knob all the way down to ensure you've received the full dosage of this medication. You will verify this once you remove the needle and ensure that the window displays as 0, Now that the medication has been administered, we want to ensure that we are properly removing the needle from the Follistim pen. You're going to utilize the outer sheath that was used when you initially placed the needle. You're going to carefully swoop the outer sheath back onto the pen and screw tightly. Once screwed tightly, you will then unscrew, and the needle should be placed back in the outer sheath, and the needle is now safely off of the Follistim pen. You will place the used needle and cartridge into a sharps container.